I'll give you the number 0705 967 6881. That is 0705 967 6881. If you're already on the live, you would know I have two fantastic women with me in the studio. I have Dr. Onome Iriri. She is a nurse, registered nurse. It's time now we said be doctor. I have a registered nurse, Onome Iriri. She's also a midwife and a public health practitioner. She's from the Mary Ehanire Mother and Child Hospital. I also have a Rabo Mary. She's a medical officer, also from the Mary Ehanire Mother and Child Hospital. Good afternoon.
Good afternoon.
It's time to go back to medical school. God wants you to be a doctor.
Yeah.
It's a proclamation.
Yes, I claim it in Jesus' name.
Amen. I'm very excited to have you in the studio.
Thank you.
We've been having so many conversations around mother and child health, and a recurring theme that we face is always antenatal. Go for antenatal. Go for antenatal. And at this point, the least we can do is to elaborate what is covered in antenatal care. So for the next 28 minutes, we'll be having a robust conversation on everything you need to know about antenatal care for expectant mothers. And you'll be hearing directly from medical practitioners. I love the fact that Onome is a midwife, so I know that she has seen things. So she's not just saying things, she's telling you things that she knows for a fact. So I want to start off with the general question. What is antenatal care?
Okay, I'll be taking it from here.
Fantastic.
Yes. So, antenatal care is a planned program that deals with the observation, education, which is very important, and also the medical management of women who are pregnant, with the aim of making sure that they achieve safe delivery and ensuring that the pregnancy journey is a satisfying experience. So, basically, the objective is ensuring normal pregnancy and the delivery of a healthy child from a healthy mother. So basically, that is what it is. And it is grouped under three broad elements, basically. First thing, evaluation.
Okay.
The second, intervention. And the third, promotion. So for the evaluation, that is where the woman registers in a health facility, preferably somewhere closer to her place, so that she can get there on time. And once the woman has been registered, of course, we need to see a health professional, preferably a doctor. So we ask some questions. Basically, that's history taking. So we ask for the age of the patient. We ask other questions like previous deliveries, if there's been a previous pregnancy loss. All this will help us to prevent any form of complication or adverse effects in the near future. And all these questions are being asked because we need to also assess the risk. So some pregnant women have high risk. So high risk is when there's a high chance of having an adverse outcome in pregnancy. So those questions are very important. So we also ask about medical history. If the patient or if the woman is hypertensive, diabetic, sickle cell disease patient, if the patient is asthmatic. So all these are just to curb complications and be able to understand how we can actually timely manage the woman. So we are, from just asking those questions, we also do examination on the patient or the woman. First of all, we do your vitals, basically the vitals, just checking the pulse rate, the blood pressure, height, the weight, calculating the BMI of the patient. Then, of course, we do a systemic examination on the woman. So, of course, we check, do an abdominal examination on the woman. So, the abdominal examination done. Of course, we want to check what we call cerebrospinal height.
What is that?
Help us is basically using the measuring tape to measure from the highest point to the lowest point, just for us to, it can help us to know the gestational age of the baby. Yes. So basically, some women just see us using tape. They don't know the reason why we're using tape. But basically, it helps us to know. It helps us to know a lot of things, actually. So if we can get the gestational age from just measuring, and we can know if this child is small for the age or large for age. So that would help us for to take a timely intervention on whatever it is that's happening. Then, of course, we have to also check the fetal heart rate, just to know if baby is okay and the heart is okay. Then, after which, doing the abdominal examination, do other systemic examination, because we want to check, like I said, the blood pressure. We also want to check for every other system. Then, after then, we also do investigations. We request for investigations, and this is to ensure baseline. Let us know how the patient or the woman's health is right now. So the first thing first, we confirm pregnancy. So you have to confirm using a blood test, or we can also use an ultrasound scan. In fact, ultrasound scan is very important to start booking. Then other investigations we do at the pack cell volume. That is also important so that we can know if the person is anemic or not, because pregnant women are also prone to anemia. Then, of course, we do a HIV screening and venereal disease research laboratory test. That is for syphilis. Then also hepatitis B and C. We also run blood group test on the patient, and also do the blood group is very important, I must emphasize, and the genotype too, because blood group, the patient might be carrying, the person might be O negative, and the child is O positive. So we tend, so that to prevent isoimmunization, that can be detrimental because that can cause fetal death. So basically, we need to know that in case we need to give the woman prophylaxis in the end. Then also, we also do a urinalysis, and then we check for a random blood sugar, just to know if the patient might be diabetic or not.
Wow. So what I'm getting from this, antenatal care is to make sure that mother and child make it through the entire process, and we do it regularly. So how often should women go for antenatal checks?
Okay, I think I will come into.
Okay.
Let me talk about that now. Before now, the World Health Organization brought a strategy which was called focused antenatal care. And in that, I would say more of a policy. It was said that every pregnant woman should have at least 4 visits of antenatal care or contact with a professional. And following, when these policies are brought up, statistics are going on to see if it was effective, yeah. So they found out that policy wasn't really it. With the 4 visits, women were still coming down with a lot of complications perinatally, which is during labor and also antenatally. So in 2016, they had to reverse that policy or modernize the policy from 4 visits to about 8 visits and more, if possible.
Yeah.
And in that policy, they note that if you have about 8, if every pregnant woman has maybe visits a professional 8 times and more, that could reduce up to 8, prevent, right?
Yeah.
Up to 8 deaths from pregnant women.
Wow.
If you're saying maybe 1,000 beds, at least 8 people will be saved if they actually visit a professional within 8 or more times.
Wow.
So it is advisable you visit your health practitioner or your medical practitioner at least 8 to 10, 11, as the case may be.
Okay.
Even if we're saying it's 8 times, we are not limiting it to 8 times, because there are some conditions whereby you just want to see a health professional. Do you understand? That's why when I'm giving health talk in my facility, I tell them, we know there are times or routines that you're supposed to come for your antenatal. The first one, when conception is diagnosed, that early stage, you're coming once in every 4 weeks.
Okay.
Till the woman gets to about 28 to 30 weeks, where the routine will not change to once in every 2 weeks. Then when she's getting to 36 weeks, we are reducing it to once in every week till she delivers. So I also tell them, I stress on it, because most people, they just roll with whatever you have said.
Yeah.
She said I should come every once in 4 weeks. So even when there is a need to access care, or they are going through some challenges, they will not want to come to the hospital because they believe the nurse said is once in every 4 weeks. So I stress the fact that if there is anything you're experiencing that is not okay, that you think is not normal, please come to the hospital. We are open to you 24/7. Even if it's at the middle of the night, you will find a practitioner that will tend to you, okay? So that is it.
All right. So one of the major issues that some women, especially women in this part of the country, have complained about is the rising cost of antenatal services. And for that reason, they are convinced that it might not be all that necessary. How necessary are antenatal services? Can you go through your pregnancy to full term if you do not go for antenatal care? I saw an article in one of our national dailies where these women claimed that because of the cost of antenatal care and childbirth in hospitals, that it resulted to getting antenatal care from herbal homes or birthing homes. Do you have any thoughts around this?
Okay, yes. So, in pregnancy, there's nothing like this pregnancy is a low risk to proven of otherwise. So, there's this risk or anything can happen during the course of the pregnancy. You know, so usually we advise mothers or women that in as much as, okay, fine, the cost is a problem. In as much as maybe the transportation or whatever the reason is, it is important that you make sure that you get yourself available for antenatal care. Anything can be happening, even as small as headache, and you feel like it is nothing, but you really don't know what the issue is. Sometimes it's asymptomatic. You're not even feeling anything. Oh, my first pregnancy was okay. Why? What is the use of me even coming for antenatal when I was able to, deliver and there was no issue? Remember, each pregnancy have their own peculiarities. Your first pregnancy cannot be like your second, cannot be like your third. So even if it is costly, it's time consuming, these are all sacrifices we need to make sure that your baby and yourself and the mother is healthy. Because we don't want to take any chances. This antenatal care is for us to make sure that we are able to get to find out any form of complication before even it arises. And even if there's any form of complication, timely intervention. And that's the reason why the antenatal care is very important. And it helps in reducing maternal mortality and morbidity rate, which is also rising and increasing. But antenatal care is very important. I cannot overemphasize that. Every woman should please be encouraged to do that, because it's just going to be for the good of that's the woman and the child. So,
I think I have something to add.
By all means, please.
To that. Like you said, people are so concerned about the financial constraint when it comes to accessing healthcare.
Yeah.
And these people should also know that it's not every hospital that's luxurious, in quotes. There are health centers that you can visit. And these health centers also have professionals that are skilled, that are good. Like the health center I worked before, we had a doctor in that health center. It mustn't be a big hospital. If that will prevent you from accessing care, why don't you visit a health center? They can also diagnose if there's a problem. And if referral needs to be done, they will tell you. Instead of you just laying back and saying, I don't have money, for my antenatal visits, I don't think I will go. Because actually, that's one of the reasons why most women don't like coming. Even if they come, they reduce the number of times they visit the facility. You could go to any healthcare center closer to you to access care. And like I said, I'm going to stress on that. If peradventure there is anything that they feel is not okay or they cannot handle, they'll refer you to either a secondary institution or a tertiary institution.
Fantastic. So, when Miss Mary, when you were speaking in your opening about antenatal, you focused a lot on the medical aspects of it. Is that the only thing that happens in antenatal? I've seen some women having a ball in antenatal, and some women said they get some prep for what childbirth is going to be like. What are the other things that happened when you come for your antenatal?
Yes, it's not just medical. So
Okay.
I was going to go over the third one.
Give it to us.
I mentioned evaluation, intervention, promotion.
Okay.
And that promotion, it has to do with education. And we don't take that lightly at all, because woman has to be educated on signs happening, especially those at first pregnancy. They don't know what is happening to their bodies. So they are basically physiological signs that happens in the body when you're pregnant. So we talk about that during the antenatal classes, which I must mention is one of the highlights of the antenatal care, because women love that a lot. So apart from just talking about that, we talk about other things, danger signs during pregnancy. What are the things that you see that you know you are alert and you need to come or run, in fact, run to the hospital as soon as possible? So we talk about abdominal pain that keeps coming and not going away, blurry vision, vaginal bleeding. We talk about leg swelling and it's not going down at all, even while you even elevate your feet. Those are the danger signs, and we talk about that. We also talk about signs of labor, the things that you're saying during labor. What are those things? What alerts you that I'm going into labor? Abdominal pain, gush of fluid coming out from the private part. Those ones are what we talk about too. Then also, not even that, we also try to allay fears. They are coming in to get information and be educated on what and what not to do. You understand? So those fears and things that you need to talk about, so that they too can be physically, mentally ready and not fearful or no anxiety because they really don't know what is happening or how their body, you don't understand their body function anymore. So we also make sure that we educate on those things. And I must say, we would also I also emphasize that your partner, your husband, to be available when we're having those classes. That would also help too, both their physical and their mental well-being. And all those things are being talked about. They too also listen and are able to pinpoint those things in case anything go wrong at all at home. They're able to alert their wife and be like, you know what, we need to be in the hospital. Do you understand? Then, apart from even the education that we talk about, we also have the treatment, giving of prophylaxis, that's intermittent preventative and treatment for malaria. We also give tetanus toxoid. And the woman should get at least 2 doses of tetanus toxoid. That would prevent neonatal tetanus. Then also routine antenatal medications like folic acid and fesolate are also given during the antenatal.
All right.
Can I come in?
Please, by all means.
The question you talked about now is a ball. Like, it's not just all seriousness.
Yes.
Like, just you have to do this, you have to do that. Because that's my area.
Yeah.
I'm very keen about it and I'm passionate about it.
I can tell.
When they come, it's not about just giving head talks and doing this. We also carry out the social aspects, which is dancing. Some of them, they are coming in serious. I try to make them relaxed by maybe dancing. Then also the exercises we teach them during pregnancy. I want to see how they can actually do it in my presence, not just using my mouth to tell them this is how you should do it. And they love it. Humans, they just like something that would make them feel relaxed.
And it's very needed, especially in that stage.
Yes, and I also teach them, I don't know if I have to say this online.
I'm afraid.
Okay. The other side, when it comes to sexual intercourse, we are
out of the baby while you're pregnant.
Yes, it's very important.
I didn't know you get taught that in antenatal.
Yes, we teach them because a lot of them has this misconception that if I have sex during pregnancy, it's not safe. I've had a patient's husband come to me to warn me, like, nurse, I don't understand what's happening. Did you tell my wife? I'm not even joking.
Oh my goodness.
It's real. So most of them do not really want to do this, and it's an interesting topic. I notice when I start talking about this and the styles they need to adopt when they are pregnant and if they want to have sex, it lightens the mood and it makes them, happy and, so.
Okay, I'm
that's
looking forward to
basically
that particular class.
Yeah.
I will attend it.
I'll wait for you.
Now, Mary, you mentioned some things that if they see some interesting signs, they should
Yes.
know to come to the hospital, whether or not they
Yes.
have the antenatal. One of the things that you mentioned is that your leg is swollen and it's not coming down. Now, when we were younger, they had this myth: say if woman leg swell up, you want born boy. And some of all these myths are still existing. So,
Yes,
what are
very
some
much.
signs that a woman could notice and know that they have to go to the hospital?
Okay. First, abdominal pain. Abdominal pain, it's not going down at all. It's increasing intensity and frequency.
Okay.
And it can even happen most times if it's a danger sign when it happens when the woman is not tame. Understand? Yes. Then also bleeding her vagina. Sorry, I have to say that. So when the woman is bleeding, and of course that is a bad sign. Then gush of fluid, like what they say, oh, my water has broken. And we call it preterm rupture of membrane. You're not tame yet, and the woman is not tame yet, and the membrane has been ruptured. That could be a danger sign because, of course, we're scared of infection. We're scared that the baby can cause contractions and the child can just, be delivered, even when it's preterm. Blurry visions, you're having headaches. Those things can be a sign of the person maybe having an hypertensive disease in pregnancy, what we call preeclampsia. So those can be, and once you're having those blurry vision and headaches, it can be detrimental. I must focus on that. Detrimental on both the baby, especially the baby, and the mother, because it can even in the long run cause seizures in the mother. Then I talked about swollen legs. One of the things when the woman's leg is swollen, especially maybe it's unilateral, just one part is swollen, and it's tender and it's not going down. We're thinking of something. One thing we're thinking of is maybe the woman has a deep venous thrombosis. Wow. Woman needs to come to the hospital. Or the leg is swollen even while the woman elevates the feet, it's not coming down. Because of gravity, the fluid can be pushed down, and that can cause edema. That's what we call edema, swelling, leg swelling. But when the woman elevates, of course, gravity is no longer there, and the fluid is pushed back.
Yeah.
But the woman is elevating and nothing is happening. That could be because that could even be a sign that the person is having an hypertensive crisis in pregnancy or preeclampsia. So those are some of the signs. And another thing is, of course, we know nausea and vomiting is normal, especially in the first trimester.
Yeah.
But some person have this exaggerated vomiting and nausea that doesn't go away. The woman keeps vomiting. Some can be so bad that it can even extend to the third trimester. So that is also a bad sign or a danger sign, meaning that the person or the woman needs to present to the hospital as soon as possible.
All right. We're going to let some listeners call in to ask questions. Just join us. You're on to Mother and Child. We're talking about antenatal care. We have medical experts in the studio. So if you have any questions around antenatal, this would be a great time to ask those questions. You can send them via text or via WhatsApp to 0705 967 6881. That is 0705 967 6881. You can also call us in the studio 0812 753 6932 0705 512 9881. And we also have 0705 572 7881. This one says, good afternoon to the nurses in the studio. Please, I need to ask a question. My wife is always asking me to come to antenatal. Is it compulsory?
Thank you for that question. It is compulsory, although not all husbands want to come. But I've had experiences where patient's husband just loves to come with them. And I think it's something that should be practiced. because most times these women, they forget information. When you come for your antenatal, you give them head talks, they get home and start doing the opposite. I've had cases where it will be the husband that will now reiterate what the nurse said, to say, Madam, I remember the nurse said you should not do this and you should not do this. Why are you doing it? So based on that, I would crave the indulgence of every husband. If you're not too busy, it would be advisable to come to the clinic with your wife.
Okay, I would also add something.
Yeah.
It helps us to, there's what we call birth preparedness. So those things that the woman would need, even the child would need during delivery, after delivery, is important because cost of things are expensive. So, of course, those things, the husband will also know about it. And at least that would also help, It doesn't only help that, they come for it also helps the women mentally. Having someone right there beside you, it helps you to understand and, gain a lot of concentration and can be able to, educate your man on the things that are happening. So he's not surprised about some certain things.
All right. Hello, good afternoon. Good afternoon, welcome. What's your name? Where are you calling us from?
Good afternoon. This is Ogbesin calling from Agboland.
Happy to have you from Agboland. Talk to us. What's your question?
Thank you very much.
Yeah.
There's a question that is in my mind for a long time, so I don't know if they can answer it effectively for me.
Okay.
In our advanced country, the husband usually associates go along with the wife during delivery. Why is it in Nigeria? It's not practiced like that.
Nurses, you want to take this one? All right, just keep listening and they'll answer the question.
Okay.
All right, thank you.
Yeah. It's not as if it's not practiced in Nigeria. I've had cases where the husband witnessed the birthing process. If you want that, it is available to you. It's just that then you have your wife stay in the private delivery room.
Okay.
Because we have the general delivery rooms. We are having like 4 couches for delivery. And it's possible the day your wife has fallen or falls into labor, there's another woman in labor. And nobody wants their nakedness to be out there to other partners. So for that reason, we advise them. I give them that opportunity. I talk about it during my health education, that we have this facility. It's just that it costs more because if you're opting to stay in the private delivery room, it has to be just you and your partner. Okay. You understand? You can even, if you want to, in quote, video the birthing process, that can be available to you.
Wow.
So, yes, it can be available to you. I always tell people I'm that adventurous. If peradventure I'm going to give birth, I would want to do that.
You will do a vlog.
Yes, I would do a vlog. I want to do that. So it is available to you. It's just that you're going to pay more to stay in the private labor ward for delivery. All
right, so wrapping up, I have about 1 minute. Any closing thoughts, any final thoughts on this conversation? Anybody can go.
Okay, so it is imperative that we key into this program because it's one of the key features of reducing maternal mortality and morbidity rate. So like I already mentioned, no pregnancy is low risk or no risk. Please, anything can happen during the pregnancy journey. What this program is to make sure that the pregnancy journey is a satisfying one. And at the end of the day, it's a healthy mother and a healthy child.
Fantastic.
And I'm going to add, it aches me when I hear some mothers say, I've delivered twice. So I don't think...
If I know what's going on.
I don't think there's anything I need to know anymore. It really aches me. Like my daughter just said, every pregnancy is unique. Every pregnancy is unique. Please do not gamble with your life because I don't think it will be a happy or a good experience that after 9 months of pregnancy, there's nothing to show for it. Our aim is a healthy mother and a healthy child.
Fantastic.
So I indulge every pregnant woman to at least visit the hospital 8 and more times to seek health.
Excellent. Thank you so much, Nurse Onomeri and Erabo Mary, our medical officer in the studio. This is a fantastic conversation. They're both from the Mary Ihanire Mother and Child Hospital right here in Benin City, Edo State. This has been Mother and Child, sponsored by the T.Y. Danjuma Foundation. My name is Joyce Chooks. This is Super 88.1 FM. Good afternoon, Edo State.
In your head.